Now, this is probably the most difficult subject to talk about because it deals with rape. Um, and people sometimes might be tempted to say, well, Father, you're a guy. You have no place to talk about these things. What are you doing talking about these things? Actually, I've gotten the phone call. I've dealt with people who have been raped. So this is very sensitive to my heart. I've gotten the call when they're at the hospital after it happened and had to talk them through it. So I think as a church, we must talk about these things because this is the time where a woman is most vulnerable and needs to be most cared for, and not pushed stuff on them that are against their morals, not pushed stuff on them that they're going to later regret. And that's what happens, and unfortunately, maybe I'm sure for good intentions, but it's pushed, they experience this horrible violation, and all these things are pushed on the person in this moment of ultimate vulnerability, and then they later realize, what just happened? So, part of the procedures, if a woman experiences the horrific reality of being raped, is they go to the hospital afterwards. What do they want to do? They want to douse the person with contraceptives, basically give them the morning after pill, so that the person can't get pregnant. And that's not the solution. There's much more specifics there. That's why the bishops and the Philadelphia Conference of Catholic Bishops released a guideline, a protocol, and the USCCB as well. So we must maintain both compassion and truth when a person is most vulnerable. And I could see this when I was talking to this person. The doctors were trying to push stuff on her that was against her beliefs. And that's why she called, because I don't know what to do. She felt so, and that's not good. A person's just been violated, to not violate them again, not push again. So what does the church teach? Let's go through the church teaching. A person who is raped isn't choosing sex. So she does have the right to protect herself from conception, from any of the consequences any of the semen of the person. She has a right. This is an unjust aggressor, violating her body, and so that she hasn't chosen the action. Therefore, having that stuff in her body is not something she chose. She didn't choose either the unitive or procreative aspects, and so that's an important thing to know. She has a right to protect herself from that realm, but that doesn't deal with the realm of the child. If a child is conceived, that child is innocent. That doesn't give her the right to strike against an innocent child. So let's go through this. It's a female who has been raped, this is the ethical religious directives, a female who has been raped should be able to defend herself against a potential conception from the sexual assault. If after appropriate testing, this is the key, after appropriate testing, there's no evidence that conception has occurred already, she may be treated with medications that would prevent ovulation, sperm capacitation, or fertilization. It's not permissible, however, to initiate or recommend treatments that have as their purpose or direct effect the removal, destruction, or interference with implantation of a fertilized ovum. So if the woman is already pregnant, there's nothing you can do. She's already pregnant. You can't strike against that newly conceived life. But if she is not, and it's been proven that she's not, you can at that point get the semen out of her, take something to prevent ovulation, because it's not going to cause, she's not pregnant. It's not going to cause an abortion. It's protecting herself from the unjust aggressor. Just like a woman who is living in a country where rape is a real possibility, could morally wear a diaphragm to protect her from that. Doesn't mean, if she had a husband, obviously she'd have to remove it. It's just a horrific realm to even think about, that a person would have to live with that type of fear. My goodness, that's just horrific. But again, it's the principle that that person is an unjust aggressor, and we have a right to protect ourselves from unjust aggressors. But the child is not an unjust aggressor. The child is an innocent victim, and the child is an innocent consequence of this crime. So we don't strike against the child. We seek justice. The person to suffer the consequences of their crime is not the child, it's the perpetrator. Okay. So this is the protocol from the Philadelphia Conference. If the pregnancy test is positive, no anti-ovulation drug can be used because she's pregnant. You can't prevent implantation. It's too late. It's done. If the pregnancy test is negative, then needed clinical determinations would be based on the following: a menstrual history. When is she expected to ovulate? Hormone levels as determined by a blood test to categorize the timing of the woman's ovulation cycle. I think it's called like the pH surge. I don't know. I'm not a doctor. I think it's called that. Results of a urine test, which are a reliable guide to the prediction of ovulations. Again, that same thing. If the urine test is negative, that may be an indication that the it's LH surge, not pH surge, has not been initiated, and a contraceptive intervention would be appropriate because she's not getting pregnant. If the urine, she's not ovulating. If the urine test is positive, that would indicate the hormonal shift that leads to ovulation has begun. The use of contraceptive steroid intervention would be an abortifacient and therefore is not permitted, even though there might be no evidence that conception has occurred, because it's too risky. If you're not sure whether conception has occurred or not, you don't strike against it. If you're out hunting and you see something moving in the bushes and you're not 100% sure that that's not a human being, you don't shoot at it. Well, I thought it was a bear. Did you see the bear? No. You're just shaking like a bear. No. You can't shoot at it. If the pregnancy test is negative, it's essential that the hospital personnel question the patient to ascertain the time of the ovulation within the menstrual cycle. If the patient has just ovulated, an anti-ovulant drug may not be administered. The use of a contraceptive steroid is permissible only to prevent ovulation, not cause an abortion. Prophylaxis for venereal disease may be implemented, to get all the stuff out. Legal procedures should be followed when they do not conflict with moral standards. Okay. Again, that's it's a very difficult subject, especially dealing with someone who has been traumatized. I mean, these are horrific, horrific things. But the goal is to care for them in the best possible way, to not make them complicit in then the destruction of human life. This is where people get into this whole argument of abortion in cases of rape. The child is not the aggressor. The child is not the perpetrator. You don't turn from one evil action to another evil action. The goal is healing. And the various, if you listen to women who have had children after being raped, and either given them up for adoption or have kept them, they'll testify to that it brought them much more healing, because they see how God brought great good out of such a tragic evil, rather than turning from one evil to another.